Hello, good morning to one and all. Myself Dr. Atul. I am welcoming you all to my YouTube channel Aradhana Ayur blog AK. In this video, we will be continuing the classes of the anatomy only. And in the last video, we have seen what is anatomical planes and four in number, that is median, sagittal, coronal, and also transverse plane. So in this video, we will be dealing with some of the terms. Anterior, posterior, adduction, abduction, some words are there which is very important when we deal with the anatomy. So we will be discussing that in this class. So if anyone is new to this channel, please subscribe our YouTube channel and also share maximum, and also click on the bell button and press on the enable all notifications so that you will reach every notification when we upload new videos. So let's go into the video. So in medical terms, we had discussed already what is superficial, what is deep, and what is median, what is lateral. So next we will discuss the superior versus inferior. This also we had discussed when we spoken about the clavicle, the bone clavicle. We had discussed this. So what is superior and what is inferior? Superior and inferior. So any structure which is near to the head we call as superior, and away from the head we call as inferior. The structure near to the head, structure away from head. So if you are considering this as an object, or this is a human body, if you are considering this as a head and this is a tail, means this is a foot. So any structure which is near to this head we call as superior, and which we away from the head, which is structures which are away from the head, it will be called as the inferior. Okay. So next is the anterior and the posterior. Next is anterior versus posterior. This is just to remind you, just to tell you what is this medical term, because when we discuss regarding the bone or the nerve structure, we will tell anteriorly placed or posterior to this or anterior to that organ. Is this superior surface, inferior surface, deep, superficially, it is like this. So you should know some of the medical terms. That is why we are discussing right now this. So what is anterior? Anterior and posterior. So any structure which is present in front of the body we call as the anterior one, and any structure which are present in the back of the body we call as the posterior one. Front of body, and this is in the back of the body. So for easy understanding, again you can consider this object, considering this as an object, and our human body also you can consider this one. It depends upon you. So any structure which is present in front of the body, so this is the anatomical position. So you know what is anatomical position right now. So any structure which is present in front of the body we call as the anterior one, and any structure which is present in the back of the body, that is this one, this is called we call as the posterior one. Okay, that was the anterior and posterior. So next let's discuss the another medical term is that is a proximal and the distal. It is the proximal versus distal. So it is somewhat equal to superior and inferior, because we use this in the limb anatomy. Limb anatomy, when we speak regarding the limbs, we use proximally placed or distally. So same as the superior and the inferior only. So proximal is the structures which is near to the head, again which is away from the head is the distal one, away from the head, that is proximal and distal, which we use in the limb anatomy. Again, coming to the dorsal versus palmar. Dorsal and the palmar. So what is dorsal and what is palmar? So palmar is the anterior aspect of the hand. Anterior aspect of the hand. So when we speak regarding this one, this is the palmar surface and dorsal surface is the back side. So anterior aspect, you know the anatomical position, you will be standing like this. If you are standing, your hand palm will be anteriorly faced. So that anterior portion of the hand we call as the palmar surface, and the back, that is the posterior. As I had told, what is posterior? Back side. So any back side of the hand, that is the posterior aspect of the hand we call as dorsal. Anterior of the hand, anterior aspect of the hand we call as the palmar. So that was dorsal and the palmar. And next one is the this is of the hand, that is where we use the word palmar. When we speak upon regarding the foot, we call as plantar. So same, dorsal versus plantar. Dorsal will be again we are coming for the dorsal and the plantar. So what is dorsal? Dorsal is a superior surface of the foot. So in foot we call this as a plantar, that is why. Okay, so superior surface we call as a dorsal, and when we speak regarding the inferior surface, that is known as plantar. Inferior surface of the foot we call as a plantar, because foot will be like this. So superior surface will be dorsal and inferior surface will be plantar. So we have spoken today regarding the superior, inferior, again that is near to head, and then when we come to the limb anatomy, again we see in the proximal, distal. So what is anterior and posterior? Dorsal and the palmar in case of the hand, dorsal and palmar. In case of the foot, we have seen dorsal and the plantar. So this were some of the terminologies which is very useful. And let's see what are the terms which are related to the movement, like abduction, adduction is there, again flexion is there, extension is there, hyperextension is there. So many words are there which we will be seeing in this video. So some terms related to movement. So first one is the flexion, very important when we study regarding the anatomy. Flexion, extension, hyperextension. So very easily you can study these three words: flexion, extension, hyperextension. Everything depend upon the angle. What is angle? You know, if you have studied the mathematics, if you have studied in your school days, you know what is angle. So this flexion, extension and hyperextension, everything depends on that angle only. So if you are considering this as a two bones, consider these two as a two bones, and if it is like this is the flexion, one bone, two bone, and your angle is 0 here, no angle, 0 degree. This is called as flexion. Decreasing the angle between the two bones is there, and angle you have decreased here, no angle only, it is 0 degree. Okay, so when it come like this extended, so you see this one bone, two bone, and some angle is created, some gap is created or angle is created, that is called what we call as a extension. In case of the elbow joint, any joint, when we consider two bones, if there is an angle created between the two bones, we call as a extension, and if there is no angle created within the two bones, means between the two bones, that is a flexion. So decreasing the angle between bones, decreasing angle between bones. That is what we call as a, that is 0 degree, we call as a flexion. Okay, that is flexion. So when we create some angle, little bit 10 degree, 20 degree, 30 degree, 90 degree, it depends upon two bones. Okay, so when we create some of the angle between the two bones, or when we straighten the, or when we increase the angle between the bones, we call as the extension. Okay, straightening or increasing angle between bones. So when we create some angle between the two bones, we call as the extension. Extension of the elbow joint, extension of the wrist joint. So between the two bones. Same in case of the flexion of the hand. Okay, flexion of the wrist. So extending or increasing the angle, extension, decreasing the angle, flexion. What is hyperextension? Hyperextension is the extending beyond the normal limit. So it is same as extension, as you see hyperextension. So extension is there, hyperextension, so beyond the limit, beyond the normal limit, beyond the normal limit. That is what we call as the hyperextension. So flexion is decreasing the angle, extension is creating the angle or increasing the angle or straightening. Hyperextension is same, hyperextension, extension is going on there, but it is a hyper condition, that is beyond the normal limit. So we call as a hyperextension. So these were some of the terms which are related to the movement, and some of other terms are like abduction, adduction is there, that you will see. So let's see what is abduction and adduction. So abduction, adduction, again mathematics, adduction, add, you can see this word adduction. So it is add plus suction, adduction, add, something you join together, right? That is the adduction. And abduction, it is something which you decrease or which you create some gap, that I will tell you very easily. Considering this as a hand, I just consider this as a human body. You can consider if you like to, okay, because consideration, we can consider, we can think anything as anything. So if you consider this as a hand and this is as a human body, two hands are there, some gap is created. This is the midline which I had told, right? This is the center part, will be the midline, which divides the body into two equal halves. So it creates into two equal, that is into the right and the left one. So this is the midline, centrally positive. So anything away from the midline, that is, this is the hand which is going away. You can see this arrow mark, it is away from the midline. So abduction is going on. This is what we call as the abduction. Not in case of hand only, any body part. So movement of the body part away from the midline, movement of the body part is a hand here, so it is going away from the midline. Movement of the body part away from the midline we call as the abduction. And when this happen towards the midline, okay, when this happen, so if this hand is going towards the midline, okay, movement of the body, movement of body part towards midline we call as the adduction, adduction. So adduction is something but movement of the body part, this one, movement of this body part towards the midline, that is we call adduction. And abduction is the away from midline, that is the abduction. So movement of the body part towards the midline is the adduction, away from the midline is the abduction. Okay, so that was something. So that was for today's class. Today we had discussed some of the terms, medical terms, some of the terminologies like superior, inferior, anterior, posterior, proximal, distal, and in case of the hand we had discussed the dorsal and the palmar. In case of the foot we had discussed dorsal and the plantar surfaces. So what is that terminology which is very important when we study regarding some of the bones or some of the organs, whole anatomy? It is very useful, and also in the physiology also. So now we had discussed the terms related to the movement also, like abduction, adduction, what is flexion, extension, and hyperextension. Flexion is decreasing the angle, and extension is creating the angle or straightening or increasing the angle. Hyperextension, again there is in the word only, hyper plus extension. Extension is the same thing. You are increasing the angle. When it increases beyond your normal limit, it is called as a hyperextension. Again we had deal with the abduction and the adduction. Adduction is nothing but movement of any of the body part towards the midline, we had called as adduction, and abduction is away from the midline, we had called as abduction. So this was for today's class. If anything doubt is there, you can comment in the comment box, and if you like the video, you can like the button, you can press on the like button. Also you can share to your friends and the relatives. It will be very helpful to the medical student especially, and also for the junior doctors, and also for the PSC students who are going through the syllabus points. It will be very useful, and if you like, you can share maximum and subscribe to our channel. Thank you, and thank you for watching this video. We will be coming with a new topic in the next class. Until then, thank you.